Okay. Hi, Jan Schakowsky. I'm getting ready for my plans and pans by washing my hands. You're supposed to do it for about 20 seconds. And one way to do it, to count the seconds, is to sing, "Happy birthday to you, happy birthday to you, happy birthday dear everyone, happy birthday to you." And then when you rinse, it's supposed to wash away the virus. Okay. All right, I'm going to meet you at my desk. Hi, okay, here I am at my desk. This is Jan Schakowsky, and I'm here with my plans and pans, and also with my container of hand sanitizer. Now, this was hard to get at the grocery store. When I went, it was totally sold out. But, you know, if you're able to get some, good to have that. Not as good as the hand washing, because we're told that washing, the soap and then the water, actually gets rid of the virus. So be sure and take care of yourself. It's all about the coronavirus right now. The WHO, the World Health Organization, is now calling this a pandemic, meaning now a worldwide epidemic. There are over 100 countries now, 4,000 deaths and counting from the coronavirus. I sent a letter to the head of the Department of Health and Human Services and the head of the Centers for Medicare and Medicaid Services about nursing home residents. Older Americans are more vulnerable, and we have already seen 20 deaths in nursing homes, fortunately not in the Chicago area, I don't believe at all in Illinois, and 10 nursing homes have reported cases. So we want to know what specifically is the administration going to do and our health officials to address the concerns that we're now seeing in congregate living places, especially nursing homes where people are frail to begin with. So this situation really has challenged everything that we know about health care and about the services that people know. And so I came recently from a meeting that was called by Speaker Pelosi, where we heard from the chairman of several of the committees about legislation that we are bringing this very night to the Rules Committee so that we can vote on it on the floor tomorrow. So the House of Representatives, under our Speaker's leadership, we're going to introduce a bill tomorrow that expands paid sick and family leave so that workers who are impacted by the quarantine order will absolutely be covered if they want to take care of themselves or their children or family members. Paid sick and family leave. Enhanced unemployment insurance. We have to make sure that unemployed people are getting the benefits that are available and sufficient for workers that may lose their jobs as a result of the economic impact of the coronavirus. Food security. So worrisome. You know, even when the government shut down for a while, we saw that federal workers were lining up in really just a few days in line to get food. What is going to happen now with many people who are laid off, their hours decreased, children at school who rely on school breakfast and school lunch? And so we are expanding the SNAP program, used to be called the food program, the WIC program, the Women, Infant, and Children program, and we're also making sure that the school lunch programs and other initiatives are implemented so that we can make sure that everyone gets the food that they need. We don't want anyone to lose access to food security during this epidemic. It's challenging. We want to make sure that there are plenty of coronavirus testing kits, equipment, and that it is free to everyone to get tested. This is regardless of immigration status, this is regardless of income, ability to pay. We want these free so that people are not afraid to go in and say, I need to have a test. And then of course we want to make sure that, and that is not in the bill, that people don't end up with these huge bills. So we know that this legislation is the beginning, not the end, to make sure that we are serving people in this crisis. So yesterday I was a part of a really great press conference that was led by Congresswoman Lauren Underwood of Illinois. And it was in part for the Black Maternal Health Caucus, about the fact that here in Illinois, that African American women are 6 times more likely than white women to die of pregnancy-related causes. This, by the way, is far more than around the country. The statistics are different. 3 to 4 times more likely for African American women to die in other states. And so we really have a challenge here, and we introduced 9 bills that we call the Momnibus, not the omnibus, but a bill an effort to put 9 bills together to address all different aspects of what are really preventable. These deaths are most often preventable, and so we're hoping that this Momnibus and these bills that are in there are going to dramatically reduce maternal mortality of African American women. And finally, I wanted to remind you once again about the census that officially starts, and the whole launch is April 1st. But you should be receiving in the mail a questionnaire. You can do it online, you can phone it in. We need to have every single person counted. It's so important for the distribution of billions and billions of dollars around the country. It's based on how many people are in a state, and of course for also drawing the lines for congressional districts. And I remind you once again that Illinois is probably going to lose yet another district. We have 18 representatives right now. We're probably going to go to 17, but if we don't get everybody counted, it could go another one, 16 instead. And so stay healthy, be careful. I'm not shaking hands. You know I'm a big hugger, many of you know that. Instead, I'm going like this, so I'm sending you my elbow as a greeting and as a farewell, and I will talk to you next week. Thanks. Thank you for watching my video. Make sure you subscribe to my YouTube channel and follow me on Instagram, Twitter, and Facebook, where my handle is @Jan Schakowsky.